You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Michigan's go-to implant dentist. He's an oral surgeon, and we've wanted him on the program for quite some time, so he's here today to talk about your options. With us, we have Dr. Mark Jesin. Dr. Jesin, welcome to the program.
Thank you for having me, Randy.
Now, I know you brought a stack of photos, so we'll try to get to as many of those as possible, but for people that don't know your practice, who's the typical patient that's coming in for implants?
Well, we basically have two types of patients. There's one type who's already in a denture and they absolutely hate it. They can't stand the goop, the adhesive, the sore spots, and they want something better out of their life.
Okay.
And so we offer them the 4 or 5 implants and they get teeth and they walk out that afternoon with a permanent set of teeth. It's an amazing process. The other type of patient is the patient who might be missing 3, 4, 5 teeth, bleeding gums, loose teeth, bad breath. They're struggling with their teeth. They have teeth breaking, chipping, and they know or they've been told that they're heading towards dentures. And they don't want to have any of that. They don't want to know about a denture. They don't want to be told about it. And they come to see us because they know we offer a solution.
Now, in your office, you said it's common, like people on the day of the procedure can walk in with no teeth and walk out with upper and lower teeth that don't come out.
Absolutely.
Is that rare?
No,
or something
we do
you
this.
Do a lot of?
We do this every single week. It's a common procedure. Patients come in. We do all of our digital scanning because it's a very digital process. Everything's done in a computer software for planning their teeth, very customized to have their teeth match their frame of their face. And they walk out, they have their surgery, and that afternoon they have a beautiful smile.
So how many people, I mean, like we talked about no more dentures at the top of the show. How many people missing like an upper, they're wearing an upper denture, a lower denture?
Between people who are wearing dentures or who are heading to dentures, you could probably fill Comerica Park 10 times. It's amazing. Wow. There is such a need for it. And people don't know their options.
So why aren't they if it's so good, if getting a new set of teeth supported by implants is so good, why aren't they all doing it? What's your take?
I'll tell you my perspective on that. So first of all, if you're wearing a denture, you don't go see the dentist anymore.
That's a good point.
Yeah. So you're out of the system. You don't know your options. Nobody's presenting your options. Maybe you go to the dentist, you have a sore spot over here, you go for a reline, you walk out, and you don't know what's out there. You don't know what the techniques that we have.
Okay.
Another reason is there's a huge fear and anxiety to come back to the dentist. Let me tell you what the life was like of that denture wearer before they became a denture wearer. They probably had 30, 40 trips at the dentist, going to the specialist, a root canal specialist, a failed root canal, then an abscess, bleeding gums, pain, hot and cold sensitivity, patchwork here and there, and throwing money this way and that way. And then finally one day some dentist comes along and tells them, you know what, there's nothing we can do for your teeth anymore and you got to have a denture. And that moment's almost a relief for them because the pain is over and the money pit is over and they know that it's done. And they get their denture and they absolutely hate their denture. They can't stand it. But like human beings, we learn to adapt and we learn to adjust to it. And so the thought of coming back to a dentist and coming back to see one of us invokes so much fear and anxiety.
So is that your challenge? I mean, the denture wearer, I think we've talked about this, you can almost help the most, but it's hard to get them in because of this, like you said.
It's hard to get people in, but what I want people to know is if you come to the right place, me and my team, we understand what you've been through. And there's no judgment here. And we want to show you that oral surgery, dentistry does not have to be like that. We consistently give people, we walk you through the process. We physically and emotionally hold your hand through the process. And I just love my team. I love what we do because from the front office to my surgical assistants to myself, we care for the patient like their family. And we consistently shock people that oral surgery does not have to be a scary or unpleasant experience.
Pain is kind of a thing of the past. I mean, you guys are sedating most patients.
Oh yeah,
right?
Absolutely.
So they don't even really...
Fully under general anesthesia. So you go to sleep, you wake up, and you have a brand new smile. No memory of what happened, no pain whatsoever. It's an amazing experience. And then afterwards, we have an amazing pain regimen schedule between homeopathic medications and mouth rinses and special workflows that we do that the patients very often report very minimal pain, maybe a few ibuprofen, Tylenol for a couple days. And it's an amazing process. The implants and the teeth are actually acting, they cover over the surgical sites, so they actually act like a bandage. So people think implant surgery, it's so painful. It is
not true?
It's not true, especially when you give the teeth, when they're screwed on, when you can walk out with teeth that aren't moving on the gums that same day, it doesn't hurt because they act as a bandage on the gums. It's an amazing process.
Do you think that dentures, whether it's 20 years or 40 years, that dentures, as we know them today, will be gone? That means they'll all be attached to something in the future?
I think that nobody should be wearing a denture anymore. I just think I think that there's so much better out there. It's something from hundreds of years ago. Why are we still offering that to patients?
Good.
Yeah, no, people deserve better. I see people, they walk out of my office and you see a light go off in them. You see their whole personality.
Really?
It's an amazing process to see what happens. They are back again. The person that they want, their inner smile comes out to match the outer smile that we've given them. And they're back at their hobbies. They're back playing tennis. They might have been afraid to play tennis because their teeth might fall out in front of their friends, and their friends don't know that they're wearing dentures.
Or water sports, I guess.
Or water sports. I had a patient who has a lake house, didn't want to go swimming. He has his grandchildren and children coming over and doesn't go in the water with them because he's afraid you lose your teeth in the lake, they're gone. You don't have them anymore. And so they're not swimming, they're not going out to restaurants with their friends, they're not playing tennis, they're not enjoying life. And that's what being in a denture is all about. And we don't want that anymore. We want to give a better life to these people.
Now, Medicare, Medicaid, we have to mention, doesn't really cover this. And even the best dental insurance only covers a small part. You say people are financing this.
Absolutely. That's amazing that we partner with third-party financing companies, and people, we find you, we work together, we fight, we're an advocate for you to find a right monthly budget that works for you. So forget about the money part. We don't want that to be a barrier. We find a monthly budget that can work for you, and you get the result that you want. You get the life that you want.
You say this is life-changing.
Absolutely. Can I show you?
Yeah.
So here's a picture of Heather. She was in a car accident 20 years ago. She had a lot of dental problems because of that. Broken teeth, crowns on teeth with cavities that were happening around the crowns. And she's wearing a partial that she hates, the gums on the partial.
Like a partial what? Partial set of teeth?
Yeah, that comes in and out. It's in the front there. You can see that the gums don't match up her natural gums, and she can't stand it. And here we give her a brand new smile. She was headed towards a denture.
She
a
would have
young
been wearing
woman
a
like
denture.
this. Yes.
Okay.
Yeah, and we give her a beautiful smile. Look at how those teeth,
Very nice.
Take a look how they match her lower lip line. That's not by chance. We design it. She wanted this beautiful Hollywood, Julia Roberts type smile, and we gave that to her. And there's an amazing story. The dentist that I worked on with this case, he was, shopping at a retail store. He comes up to the retail counter and he sees this woman, and he's like, whoa, you have a beautiful smile. And she's like, well, thank you. You did it for me. And it's amazing because,
So even he thought they were real teeth.
Even he thought. He didn't recognize his own work. And it just also shows you that she's just constantly beaming out there in life. And that's what we hear from our patients. They can't stop smiling. I had another patient who we did this on, and she said she goes to the grocery store because she just loves to smile at people. She just loves to walk the aisles and smile at people.
So they smile more. Now these are very natural.
Thank you.
And you do it in-house.
Absolutely.
So when it's all done, do they say, I should have done this years ago?
Absolutely. We consistently hear that. They're like, I don't know why I didn't come to you sooner. I didn't know about it. I was afraid. And there's no reason to be afraid. You just have to come to the right people who are going to help you through that process.
Okay, good. Yes. So you brought some more photos.
Yes. So here is Bob.
Okay.
And take a look at Bob. Beforehand, in that before picture, look, we couldn't even get a smile out of him.
So that's him smiling.
That's him. He doesn't want to show his teeth. He's, he could be walking around. He is a funny, pleasant man. He's a lovable man. And you could be walking around and think he's a grumpy, unhappy person. So he had some teeth left in his mouth, but they weren't doing well. And his option was a traditional denture, just something that floats on the gums. And, it's not fixed in there. And he didn't want that. And in one afternoon, we gave him a set of teeth that don't come out. So he walked out with that smile right there. And that's how he looks now. We can't get him to stop smiling. Look at him. He's exactly the person. We just brought out that inner personality that was always there. We brought it out to the forefront.
How soon could he eat? And what could he eat?
He can eat that afternoon, that day when he gets home. So you start off on softer foods. If you just had the surgery, you start off on softer foods. And then as the implants mature, you can eat whatever you want. We consistently get questions. Can I really bite into this apple with my front teeth? I haven't done that in 15 years.
Can you?
Absolutely. Peanut brittle. We have patients. I have a patient, caramel corn. He hadn't had caramel corn and wanted to have caramel corn. I had another patient dreaming about steak. He told us.
Dreaming about it.
Dreaming about it. He told us when he goes home, he's going to have a 2-inch thick tomahawk steak.
Okay.
That was what he was dreaming with butter on it.
You don't get a little nervous at all?
No. These teeth are made out of zirconia. It's like a white metal. It is strong. It's stronger than your natural teeth. Way stronger than your natural teeth. You can't break it.
So a person like this, do they like the looks of it or what they could eat?
Everybody has a different motivation. Some people, their motivations function. They want to be able to chew without pain. But then they get a compliment. And all of a sudden, they start posting on Instagram and posting photos of themselves because they like the looks of it. Because people are complimenting their smile because it looks beautiful. And then there's the other person who all they want to have is a beautiful smile. Maybe they want to go on dates or they want to look good for their son or daughter's wedding. And then all of a sudden, they have teeth that function and chew and they can bite into that apple. They can eat vegetables. They can eat fibrous foods again. All the diets of these days, what do they say is healthy? Eat nuts and seeds. How can you eat nuts and seeds and healthy foods? Yeah. All the health foods out there, you can't eat them in a denture. You can't extend your life with longevity by being in a denture. So, it depends on the motivation, but in the end, they all come together as one. People love the looks and they love the function of it.
So you're a specialist, an oral surgeon. Does it cost more to go to an oral surgeon?
No, it doesn't have to be because getting it right the first time is important. This, like I said, is very complex treatment. And if you go to the wrong center and they're putting it in the wrong areas and they're not putting it in good bone, they could start failing and not lasting for life. When we do it, we plan it and make it in a way that it's going to last your lifetime.
Okay.
And
yeah, but isn't it true if you've been wearing a denture like 20 years, 10 years, you don't have enough bone to do this?
That's a great question.
Okay.
We regularly have patients come to our office who've been told that they don't have enough bone in another office. And that was probably true in that office, maybe with that doctor's skills or that doctor's technology. But in our office, we have the techniques and the skills to put specialized implants, zygomatic cheekbone implants. So there's many.
So you haven't had to turn anybody away and saying there's nothing we can do.
We literally have patients who come in 0 bone in their upper jaw. Literally, the bone has receded to the base of their nose, and they can walk out same day with cheekbone implants. They walk out same day chewing just like everybody else with fixed set of teeth, non-removable set of teeth.
So this is what you do routinely?
This is what we do routinely. These are our difficult patients that we get, but we are the experts in doing that.
How old can you do this? Like, what's your oldest patient?
There's no age limit. Bob, who we just talked about, he was in his mid-80s. I've done it on 90-year-olds. We do it 60-year-olds. I've done it on 20-year-olds.
But a 90-year-old is not more likely, statistically, to fall out?
No, if you're healthy enough to walk into my office and you're healthy enough to want to live life to your fullest, you're healthy enough to get dental implants.
Now, for the sake of time, I'm going to kind of rush you a little bit. I know you wanted to show those photos, so what else are we looking at?
So take a look at Lisa here. So Lisa, again, so many people are judged by, she came to our office, her consultation literally broke me down into tears. She told me how she's judged at parent-teacher interviews, how she feels people look at her like she's unclean.
So did she just not smile because of that?
Yeah, she would cover her smile. She told us she's such a happy person and a joyful person and wants to show that to the world. She's a loving person. And she couldn't show her smile because she was embarrassed, so people didn't know that she was a loving, happy person. And
so she would have been wearing a denture?
Oh, absolutely.
Those teeth couldn't be saved.
Yeah, she was suffering with a bacterial infection, gum problems, and she's a very clean person. That's why there's no judgment here. She was trying so hard, brushing her teeth, flossing, gargling, and nothing. She couldn't get ahead of the bacterial infection. And so we gave her the smile, and just look at that.
That's amazing.
I mean,
That's
she
good.
cannot stop smiling, and it has changed, done wonders in her life.
Completely changed her appearance.
Oh my God, she is younger, healthier, vibrant. She's now a manager at multiple restaurant locations. So her promotions at work. So we talk about this being an investment. Yeah, there's cost to it, but it's an investment. Just like any investment, there's returns. And look at the returns: promotions in life, happier life, better relationships, better jobs, better salaries. It's an amazing process.
So when she sees that mirror for the first time, Because you said sometimes you get choked up. In fact, you said you cry sometimes with the patients.
Literally, we fight sometimes, my assistants, who can be in the room for that moment, because it's a powerful moment. When you give a patient that mirror for the first time and they look at it and they see their smile, you can see it light up in their face, and you can see sometimes a tear.
Nice. That's very
you
nice.
can see a tear come down, and grown men start crying and hugging you. It's a very, very powerful emotional moment, and I live for that. That is why I do this, is consistently just to see that process. I love it.
We've talked a lot, because there's a lot of things you do as an oral surgeon. I mean, very complex stuff. But this group of people, he says, like, giving somebody their smile back is like the most rewarding of everything you do in oral surgery.
It's the most rewarding because they're so appreciative. They become patients like family. They become, like, for life, family members. And I just connect with all of them. They come see us. They're walking into our office. You see the changes in their life, the skip in their step.
Okay.
You know, you see the charisma back and their mojo, and they're walking in there a whole different person.
Are couples doing this, like a husband and wife? Like
Absolutely.
one gets it done, and then the other one might get it done?
Absolutely. One, the braver one gets it done first, and they want to get it fixed up. And then, me too now. I need to get it done as well.
Good for you. Okay, so a couple more.
So take a look at Felipe here. So he was on a lot of medications, had dry mouth, and his teeth were decaying away because of the dry mouth. Again, there's so much judgment that people with bad teeth are unclean or, not taking care of themselves. No, he is working hard, but he can't get ahead of his medications, which are drying out his mouth. And he was headed toward dentures. And he was not going to accept that. And look at that beautiful smile.
Wow.
It's just amazing.
Is that also like in one day? I mean, they go in with, extractions, get the teeth.
Extractions, clean everything up, put the implants in precise, accurate locations, very, very important, and fabricate this computer digitally designed set of teeth that they can walk out and enjoy.
Now, you say you have to teach people to smile. What does that mean?
Well, I'm going to show you some of these cases where, they haven't smiled in years. And you ask them to smile and they have a grimace.
They still cover it up.
They still cover up, even though you're asking, give me your best smile,
Okay.
show me your teeth. They can't do it. They've lost the muscle memory. Can I show you some more?
Sure.
Perfect. So here's Cindy. And take a look at Cindy. Again, she was having problems with her teeth, missing some teeth and some broken down teeth. And she, again, was going to head to dentures. And look at what we did.
It's very nice.
It's beautiful. I mean, just look at the youthfulness in the before and after picture. She was going to get married. She just wanted a natural smile, something that was age appropriate in shade that, if she walked into work the next day, you might not know that she had her teeth done. That's what we want to create. You might say, did you change your hair? Did you go on vacation?
They
What
tell you
happened?
this?
Yeah. They don't know what you've done. They just know that you look amazing. You look younger. You look vibrant and healthier.
But everybody says the same thing. I should have done this years ago.
Yeah, look at it. It's like a natural facelift. Look at her cheekbones. She looks healthier. She looks vibrant there.
But if they have gum disease and they have really bad gums, and that's why they're losing their teeth or lost their teeth, are their gums too bad to get this?
Not at all, because with the surgery process, before we even place implants, we clean out the gums and disinfect them.
Okay.
It's a very, very strict protocol. So if you've had bad gums before, it's a complete fresh start. It's an amazing process. You're a candidate for this.
That's nice. Okay.
Let me show you another case here.
All right.
So this is Case here.
Okay.
He did not see us in time and got into a denture. He was wearing a denture and hated it. He couldn't stand that the plastic was covering his mouth. He couldn't taste his foods. He hated how it just was moving around on him, and he wanted a solution. And he came and saw us, and we gave him this, permanent set of teeth. And it's a different person. When Case walks into the office,
Okay.
I could be in the back room and I can hear him in the front flirting with the girls,
Okay.
telling jokes. He's a character, and this brought out that character in him, the character that always was there.
So no
The
more
life.
dentures.
No more dentures.
Thing of the past in your office.
Absolutely.
Now, you are the busiest, I guess, in West Michigan by far, implant dentist.
Mm-hmm.
I mean, you're an oral surgeon, but I think we've talked about this, that you have the most state-of-the-art and the busiest implant center
Yeah, we're passionate.
around.
We're passionate about being the best that we can be and having the best technology. So people come to us from all over because they're searching for the best. They're searching for people who stay on top of the best techniques, and that's what we're providing. We're not providing old techniques of the past. We're not settling for our patients. We're not settling for the status quo. We're giving them what they want. They want to live life to its fullest. They don't want to think about their teeth. Do you think about your teeth? I don't think about my teeth.
Good point. Yeah, I don't.
I have enough problems to think about. I don't want to be thinking about my teeth. We want them. Teeth problems are a problem of the past. You don't think about your teeth because you don't notice them because they're working for you. Let me show you this next patient, Dale over here. Young, healthy guy, just has some bad teeth. He's missing some teeth and he's missing a front tooth, and he is not going to accept a denture. I mean, this guy's buff, he's good looking, he's healthy and young, and we give him a brand new smile there. Look at that. It matches the picture frame of his face.
I mean, teeth make you more handsome.
He's
or
handsome.
more attractive.
Absolutely handsome, attractive, vibrant, competent. Anything you want to say. There's a million things you could say about him between the before and after photos.
And then he just he maintains them with his general dentist, just like a regular person with teeth.
It's easier because you're not scraping with bleeding gums. We literally can unscrew these, polish and clean them outside the mouth, and you're back on your way.
Looking good.
Looking good.
Okay, good.
Yeah.
Time for a few more.
Let me show you
I'm
another
going to
more.
rush you a little bit, but these are really good. These are really good.
This is Lori. Look at that before picture. She's missing half the teeth there on the upper jaw, struggling with a partial, headed towards dentures again, and doesn't want that. And look at that after picture. Look at that smile.
This, I'm holding my words back, but it almost looks like the daughter of the person in the before photo.
Absolutely. It's taken 20, 30 years off of her.
She looks a lot younger.
Yeah, and these people become our family. She's an alpaca farm owner, and literally I visited her farm. My 3-year-old daughter has visited our farm. These people, they appreciate what you've done, and there's an amazing appreciation, and there's a connection. We feel the connection because of how we've changed their life.
Good for you. Oral surgeons, I got to tell you, I've had oral surgeons on the show before, and they're kind of like the science nerds of dentistry. And they, but you have like all this personality. I mean, you care. Like I asked you, what I asked you? I have it in my notes. I said, kind of what's your secret? Like because you're the busiest, you said, because I care. I mean, I'm paraphrasing you slightly.
Yeah, I just like to help people. And I want to show people that oral surgery, dentistry doesn't have to be scary. It doesn't have to hurt. You just have to find a person who has a heart to help you.
Very nice.
Let me show you this here. This is Linda over here. So Linda is a very special story for me. She was a young patient and struggling with teeth that were decaying on her, and she couldn't get ahead of it. And again, faced with dentures at such a young age.
Wow.
And look at that after result. And what I love about the after result, aside from the beautiful teeth, look at the makeup on her face.
Okay.
She told me that in high school, she loved to do makeup artistry, but she got away from it because she didn't want to attract attention to her face anymore. Now that she had her teeth done, she's doing makeup again. She started a blog on makeup artistry. So she's back to her passions. This is what we see people regularly, back to reinvigorated with the passions that they had in life. And she's one of our biggest patient advocates, a lovely woman. So take a look at this. Here's Mike. Mike was in a terrible car accident and had some severe PTSD from it. And literally from anxiety and PTSD over the years ground down his teeth to the pulps. He was having daily hot and cold sensitivity and faced with having all of them removed and getting dentures. And he was not going to accept that. And we did this for him. He is one of our most appreciative patients. He writes us letters. He's like our cheerleader, trying to let the world know how amazing this procedure is. He can eat anything he wants.
Very nice.
Yeah. Can I show you another?
It looks natural too. Yes. Time for probably just 2 more.
I just want to show you this.
Okay,
patient.
This is good. It's like you're showing me baby pictures. I mean, you love these
I'm proud
photos.
of them. I'm proud of the work. This is Connor, a young patient, and had a habit of soda and just couldn't get ahead of it. At one point, it got too much, and he was faced with dentures at such a young age. And what I love about the before and after, take a look at the after, not just his teeth again, but look at everything. Look at the hair. Now he's putting gel in his hair. He's walking in. And I love, if you take a look at the before photo, this is another patient who just didn't know how to smile. We asked him to smile before, and he's just learning. Even with the after, he has a little bit of a grimace there because he's just learning the memory, learning to smile again because he forgot how to.
Very nice.
Take a look at this one. Here's Jennifer. We just did this surgery 2 weeks ago. So this is still her temporary set of teeth, but they're screwed in there. She walked out with a set of teeth that are permanently fixed in there, but that's her temporary set of teeth.
And she would have potentially like had a flipper or some removable something.
Oh, she would have been in a denture flopping around her gums that she can't chew or eat, pain from moving on them.
I'm surprised it's that common.
It's
where you
so
are.
common.
That people are wearing an upper lower denture.
People think that they can't afford them, so that people they don't know their options.
And nobody likes going to the dentist either,
No,
especially the oral surgeon.
Exactly.
They know they're in trouble when they go to you, right?
Yeah. So we did this for Jennifer, and just 2 weeks in, I see a difference in her. I see the light in her. I see her this calm over that has come across her, and she's just happier and just a sweet person. And I'm so happy for her.
Okay, good. Time for that last one.
Last
Very
one
good.
here, Mitch. So Mitch is a father of 4 boys, hockey dad, and has spent his entire life, giving to his children. And at some point, he had a tooth problem, and that went bad, and then it compounded from there, and it got out of hand, and he was faced with teeth that were breaking on him and potentially needing dentures. And we gave him this set of teeth, and he can literally chew anything he wants. Those are zirconia teeth. He can chew through whatever he wants. And you know what he said to me?
What?
He said, you know what the downside of implants is? He tells me, because he gained a little bit of weight in that after picture. He says, you gain weight because you can eat whatever you want now.
So they could eat, so it doesn't matter. Raw vegetables, or you tell them to take it easy? And I asked you that earlier.
No.
But like a carrot with your front teeth?
Carrot with your front teeth, apple, peanut brittle, whatever you want. When you're in your final set of teeth, they are strong.
Now, one of the things we haven't talked about is snap-in, snap-out teeth supported by dental implants. It's big, a big topic, and you say you don't like it.
Well, we offer all the options. Trust me, every patient gets all the options, but it's not my favorite. It's not what I would want for I want
like a snap-in, snap-out.
No, I don't
teeth
want
you
to take out a plastic set of teeth, even though it clips into a couple implants. I still don't want that. Having to clean it outside my mouth, having to get food stuck underneath it, and all the maintenance that comes along with that. I want a permanent set of teeth that's screwed in that feels like my natural God-given set of teeth.
So somebody watching this, if everything goes right, but they're either wearing a denture or they need a full mouth of extractions, next month they could have their teeth, or 3 weeks from now they could have their teeth.
They could have it, absolutely. Schedule a consultation with us. Our consultations are free.
Do they get to see you?
They get to see me. They get to see our team. They get to meet our implant coordinator. They get a 3D CT scan, and we literally show them exactly the process of what we can do for them.
And you'll even discuss financing.
Yeah, and we'll find a financing budget that meets their needs, because we don't want that to be an obstacle. We know what we can do for you. We know that this is the best option, and we know you're going to love it. We just have to find that pathway to get there.
And you don't have to switch dentists. That means if you like your general dentist, they'll work together with you to get this done.
We work together with them. Yeah, we're great at coordinating with the dentists, and we work with the entire community of dentists around us.
And if they don't have a dentist?
And if they don't, we have a network of dentists who are really skilled in this that we can connect you with.
Final message. Somebody watching this, of the 2 groups, one group, their teeth are bad and they're headed to dentures, and the other group, they're currently wearing dentures. They've heard what you had to say today, but maybe they're still putting it off or skeptical or afraid. What do you say to them?
I would say come in and just meet us. We're a great group of people. We're going to walk you through the process, show you what can be done, and we're here for you. We're here if you're ready, if you're not ready, if you need some time to think about it. Whenever you're ready, we have a solution for you.
Right there. I want to thank you for coming to the show. Great stuff.
Thank you very much, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.